Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. It is 9 a.m. on Friday, so you know what this means. This is Friday Friends. I am Deb Burton, the Executive Director of RI Elder Info and creator of rielderinfo.com. And every week we come on here and chat with folks who are doing some really amazing things out in the community that you need to know about. So super excited to have these opportunities to share information with you every week. And we would not be able to do that without the support of our sponsors because we are a nonprofit. So big shout out and thank you to our new sponsor, Aetna. They are a Medicare insurance company providing amazing services here in Rhode Island. A shout out to Oak Street Health. They have locations in Warwick, 2 spots in Providence, and in Woonsocket. They provide comprehensive medical care for our older adults, including transportation to the doctor's office, which we know becomes a little more challenging sometimes. And a also big thank you to Tamarisk Assisted Living. They are located right over by the Warwick Mall, and they really treat your family members like their own family. So I encourage you to reach out to Susan or Sean. Big thank you to United Healthcare, also an insurance company out here in Rhode Island that provides great Medicare coverage for folks. Give Jennifer Barrows a call at United Health. And the magic that you're seeing happen, look, I'm hands-free. That's from the magic of 321 Media and Ben Barber behind the scenes. He is my Oz here in the wonderful world of RI Elder Info. And also, if you've seen the website, and I'm sure you've seen the website, right? Or you will as soon as we're done, rielderinfo.com was created by the award-winning web design team, England Studio. So if you have any web design needs, I encourage you to reach out to Dave and Sal. They really get it. So this week, I am talking to someone who I refer people to and I lean on when I'm stumped on resources. So there's not I think a better person for this conversation as we kick off the month of June. We are also having conversations regarding elder abuse because we know that 1 in 10 cases of elder abuse is reported. And part of keeping people safe in the community is being able to access the services and resources that are out there. So I want to welcome up Kathy Shatraw from the Linn Community Health Navigation Team. Not sure I even said that right. Welcome, Kathy.
Good morning. How are you today, Deb?
Good. I think I mangled your title.
It's okay because I actually have I have an update because we've actually changed my title.
Oh, good.
I am now the Aldersbridge Navigator.
Okay.
It's a broader spectrum, and I think it's a little bit easier for folks because this way, knowing that we're a community-based program, it just allows people within the Rhode Island area to know I service pretty much the whole state of Rhode Island and are able to help folks. Not right yet serving Block Island, but other than that, yeah.
Well, I think you need to get funding to be able to go to Block Island for the summer.
Yeah, I know, right?
So tell everyone, what does a community navigator do? Well, why is this important?
Sure. So it's the position is actually a relatively new position. I started in the role the end of October. The concept is actually, as I said, it's community based. So it's meant to be a program to help elders stay at home in the community for as long as possible, as safely as possible, by linking them up with the necessary resources to be successful. In some instances, it may be where someone's aging out and they do need assistance with getting into an assisted living or nursing facility. But ideally, There's many, as you know, obviously, and there's many resources to help folks to be successful at home, but they may not know how or where to go about getting them. And it can range anywhere from helping people with that may not even realize that they're eligible for Medicaid, community Medicaid. It could be that they need assistance with meals. Meals on Wheels, or there's actually some private companies that are out there that will provide different types of meals and bring them to your home. Could be someone who's looking for, perhaps would be benefiting from the socialization of the senior center or an adult daycare. Could be, I've seen people, and it sounds crazy, but we've all seen people as far as taking meds. I literally had a woman not that long ago show me a pot full of her medication. Some of them she knew what, yeah, she had all her meds in there. Some of them she knew when to take. Some of them she wasn't 100% sure. But there's some of the pharmacies that are out there that are able to prepackage the meds and actually deliver them directly to their door, just to make it a lot easier for them. So what I'm able to do is actually go out and meet with the elder and or family members and actually do an assessment, because what they may originally call me for, once we start talking, you find it's kind of I call it like an onion, and it's different layers. So you find that there are, there's different needs based on what the situation is that the person's going through. And then we work together with, a care plan of sorts. And I help them coordinate, and can either connect them with the appropriate services, and maybe, helping them fill out some of the paperwork that's needed, so I can provide some of the case management, that's needed to follow up with that client as well.
Wow. So are you a social worker? Are you a nurse by trade? What is your background? What drew you to this? Because it is a unique field, and there are not many folks like us out there.
Okay. Yeah, that's true. So actually my background is, yes, I do have a bachelor's in social work. I started shortly after graduation, and honestly, my first job, I worked in a nursing facility as a CNA all through high school and college. And then when I became a social worker, was a social worker in a nursing facility. I've been an assisted living and a nursing home administrator, as well as I've been the community liaison for 17 years with Charter Care Home Health. So I think my background working in the different areas that are tied into working with elders really has lent a nice opportunity for me to really mold the navigator role and kind of know literally how to navigate people through the different arenas and areas that they may need some assistance in.
It's interesting when you say it's like an onion. I know I'll get calls of, I need a nursing home list. Well, maybe you do. I'm not arguing that you don't. And that's really easy to provide. But is a nursing home really what somebody needs? And I think it's really important to have conversations that include all the different aspects. What are some of the common questions that you get asked?
First, I just want to comment on what you just said about the nursing home, because the interesting thing is when I started this role, I received a call from a family member who said to me, and she was in panic, "I'm calling because I need my mother needs a nursing home." And I said, "Well, why do you think your mom needs a nursing home?" And she said, "Oh, she's older." And I said, "Okay."
So am I. I'm older than other people.
Right. So I said, "Okay, let's set up. Can we set up an appointment?" I went to her mom was living in subsidized housing, had been there for 20 years, 99-year-old woman.
Oh, God bless.
So exactly. So she's actually was at home. She had a home health aide, but for a very limited time frame. So she was eligible for more time, but didn't realize that, number one. And then number two was more a matter of the daughter was the primary caregiver lived right around the corner. The mother had some different physical issues due to her extensive arthritis. So we talked about, having visiting nurse come in, coordinating like rehab, knowing that they could come in and do some therapies like in the home, which she had no idea, helping her with the meds, as far as doing the pre-packed meds. And then contacting, I helped contact the folks with the company that she was working with to get her, more home health aid time. I said, can I make a case for her to go to a nursing home? Sure, I could. But does she need to be in a nursing home if she's home, safe, and functioning? Well, the first thing I noticed was she had a throw rug in front of her chair, and we talked about that, like she was using her, a walker. And I said, my concern would be, are you going to fall as a result of, that? So just some like really basic, simple things that we kind of went over. And then the truth of the matter is the daughter really was nervous because she wanted to go to her grandson's upcoming graduation and didn't want to leave mom alone, and was like really panicked, like, what am I going to do? And I said, we could also work on a respite. And that being said, if your mother's in, comes to a nursing home, because she said with COVID, she had decreased socialization. So if she goes to a nursing home, short term, couple of days while you're away, and she loves it, sure, she could stay if she wanted to, but she doesn't need to. She doesn't have to, because we can institute what we need to make her successful at home. And it worked. So it's just, a good example of what you were saying earlier in regards to the nursing home piece.
Yeah, absolutely. And I just wanted to say good morning to Carrie Lynn and Sue and Heather, and good morning, Dante, and hello, Stella. I see you. So Sue had a question. One of her loved ones moved from home of 30 plus years to an assisted living facility and wants to know if there are any tips on how to help her transition into this new lifestyle and life change.
So I think, and that's a good question, because I think it is a change, and it's something that I think if she is able to work with some of the staff members and engage in some of the different activities that they have, and kind of pick and choose some of the things that she may like, or may be interested in, and then as she starts to do that, may meet new people, make new friends, and then find that she's able to transition, a little bit easier. I encourage her to participate in the activities and try them, because sometimes people say, you know what, that's not me. I'm not a joiner. And it's amazing how many folks that I've seen that actually, once they start engaging in some of the programs and going, I've had people say, I'm not going to eat my meals, in the dining room. But just that level of socialization really brings a person out of their shell. So I think the more that they can get involved in the community, the better they can make the transition.
Yeah, that's super important. Now, do you have any recommendations for transportation? That's one of the issues that comes up a lot for our older adults.
You and I have talked a lot about that topic. I mean, I know it can be challenging, because obviously there's MTM is the prime that we have here in the state. We also know that there's the RIDE program. There's also obviously Oak Street. If folks are tied into Oak Street with their physician, then they have that transportation. It's interesting, because I've heard at one point, Age Friendly Rhode Island was looking at that prototype from the Boston area with having it could be something, college students, if an elder, let's say, had a room in their home and they needed assistance, and they could from that actually perhaps have a reduced rent rate, and then what are the types of things that the elder may need? Could it be taking someone to and from doctor's appointments or to the grocery stores, things of that nature? Could it be they need someone to shovel the snow, help with different chores around the house? And I think that's not a bad concept to actually try and pursue a little bit more, because I think there's a lot to be gained from that concept.
Yeah, that program is called Nesterly, and the creator of it is from Boston, and I think she's taking the program probably worldwide. She's very nice. I've spoken to her on the phone, and it's a great concept. So, with you being part of the Aldersbridge Communities, which is a nonprofit organization that provides some long-term care services, are you limited to helping people if they need long-term care to only going into Aldersbridge, or can you help them into any place that best meets their needs?
Sure. And that's a good question, because it's actually when I started getting back involved with my networking groups, when I said I was in the Linn Navigator, the initial assumption, even from my professional peers, was that, okay, so you're helping to coordinate people go from, Linn to one of your assisted livings and back in the community. And again, that's the misnomer of that, is that Aldersbridge, as a community, was thinking out of the box and wanting to be able to offer what they felt was a missing link to help the elders within the community. So as far as Aldersbridge does have the 3 assisted livings, so they have St. Germain in Woonsocket, they have Arbor Hill in Providence, and Winslow Gardens that is attached to Linn. There may be times where it may be appropriate and it may be an appropriate referral for someone, and they may be interested in looking at one of our properties, but that's not the intent. It's actually, I really look at the cases that I'm dealing with, and I always try, depending on what the situation is, and encourage people and give them like at least 3 or 4 options. And if it were something where I would say you might want to consider one of our facilities, I encourage people to go look at the facilities. So I just recently had someone I was working with that was in the North Kingston area, and it was a very difficult situation because the woman was unsafe at home, was confused, wasn't eating appropriately, wasn't taking her meds, and I did have to report it as a self-neglect case. And there were like about 5 different nursing facilities that we worked with down in that area, and thankfully we finally were able to get her into a nursing facility. But her daughter said, I've been trying to do this for months. I just don't know why it was so difficult, and you were able to accomplish getting my mom into the facility. And she literally sobbed when I called to say, we have a bed, and she was like so excited and thankful. But again, working throughout the state and different areas, I have to be honest, I've been in pretty much most of the assisted livings and nursing homes throughout the state, as I know you have, for different reasons at different times. So I kind of, as I get to know people, can kind of get a gauge and kind of steer them in certain directions to say, you know what, I think these may be some viable options, and encourage you to go see them.
That's really important. And you bring up a really good point, particularly since June 15th is World Elder Abuse Awareness Day, where we try to raise the fact that elder abuse exists. During the pandemic, it has really skyrocketed. One of the things that people don't realize, excuse me, when somebody can't take care of themselves and they are what's called self-neglecting, that has to be reported to the Office of Healthy Aging. I think a lot of times we think of abuse as like, people like beating you, which is abuse, no question. But you mentioned that you found this woman and she wasn't able to take care of herself and you reported it. Do you have the information on where to report elder abuse?
I don't have the number in front of me
Okay.
right now. I don't know if you do have it.
Yeah.
Well, you know what? I do have it. Hold on, I have it in my phone.
So we have these options. I think we have that available to come up. Um, and it's important that everybody realize that everybody is a mandatory
Report.
reporter. Nobody gets out. So, and it's not one of those things where it's your job to prove it. Like there are businesses, there are people out there who work to prove the elder abuse, to investigate it. Not your job. All you have to do is think it happens. And there's that number, 462-0555.
And you just give basic information, like you said, in regards to what are the areas of concern, and from there it gets assigned to a protective service worker, and they will go out and do their assessment and see what's happening. I actually, in that case that I mentioned, I did get a call from the protective service worker, and I kept her abreast of what was happening, because she said what you're in the middle of trying to accomplish, that's really what needs to be done. And unfortunately, the other caveat to this was she was okayed for 40 hours. She's on community Medicaid for 40 hours of a home health aide. Unfortunately, there was no home health aide to service her in the North Kingston area.
Are you seeing that more often? A
Yes.
lack of healthcare workers?
Yes, I think, and I've, when I was talking to the protective service worker, she said, there are a number of cases that we've had that people are eligible for that, home health aid, and we just haven't been able to find someone, especially in the different parts of the state, like the northern part of the state and the southern part of the state seems to be the biggest pull for where it really is becoming a challenge. To find the folks. They may be okay to actually acquire the service, but now the real challenge becomes, finding that individual to fit the need.
Right.
Yeah.
And yes, you're eligible for services, you're eligible for somebody to come in, but there's not an actual body to do the job. And I think that's really important for the people watching to understand is apply for services, but also have a backup plan if it takes a while for services to get started. I think that's really important. Go ahead.
And it's not always. I mean, sometimes people have family members, but I'm also seeing, and I'm sure you have, a number more that really don't have a lot of family. So that makes it even that much more challenging to look at, okay, what are the ways you get to somehow be creative in how you can try and piece together helping folks remain safe at home.
Yeah. And you bring up a good point. We are often aging alone. And it could just be, our kids grew up and moved away. I mean, that really has been the way of the world for the last, 30, 40 years. So when there's an individual at home, and maybe they do have children who are nearby, and they are in need of help, but don't want help, do you have any tips for how to start that conversation with somebody who clearly needs help, but they're really resistant to that? You have any pointers on how to have that conversation if there's family members watching?
You mean in engaging the family members?
Engaging the family members, and when it's the older adult who's like, yeah, I've fallen a bunch of times. Yeah, I can't really cook for myself, but no, I don't need help. I don't want help.
Yeah, I mean, I think you can, if you try and give some examples of ways that whatever it is that whatever intervention you feel is going to be successful,
Mm-hmm.
how it could be successful, if you have some success stories on how some other folks have been in a similar situation and have been able to although it seems as though it's not something that you want to engage in or in a point where you want to try and overcome it, just knowing that there are other people out there that you might be able to give some examples to, I found that to be, helpful. And I'm working with someone right now who's kind of on the fence about going to assisted living. And it's interesting because I helped someone get into assisted living just a couple weeks ago. Her vision of what assisted living was when her mom was in a nursing home. So when she first walked through the doors of the assisted living, she turned to her daughter and was like, wow, this is not what I envisioned. This is not what I had in my mind. So sometimes too, I think, people have a certain idea or preconceived notion in regards to what something may be. And then if they're actually exposed to it and see it, and as I said to people, even if they're filling out the applications for assisted living, that does not mean you're signing up for assisted living and you're going tomorrow. That simply means that we're giving the information. You have the opportunity to go look at XYZ facility, and just kind of get a feel for it. Because honestly, every facility, nursing home, assisted living, has its own flavor to it. It has its own feel, and it depends on what your comfort level is. And I think the more that you can give people examples or actually engage them in what that next level is that you're trying to work with them on, it becomes a little bit easier for them.
So, Kathy, if people wanted to utilize your services, how do they reach you?
So they can contact me by calling 401-654-4006. That's my direct line. And I know you also have the main office number, but we can.
So you said 654-4006?
Yes, that's my direct line at work. Yep. So
Okay.
they can contact directly, or as you have up on the screen, they can contact the 438 number and get through my extension that way. Either way.
That's awesome. Are there certain hours that you work? Are you Monday through Friday? Are you available on weekends or after hours? Because sometimes caregivers work during the day.
Yep. So I typically do work Monday through Friday. But the nice thing is, and I work a couple days a week from home, but my phone is actually tied in literally to my computer, so I can check and see who's calling and who's in need, and I get back to them as soon as I possibly can, certainly within less than 24 hours. So it's a pretty quick turnaround.
That's good. And are you finding in the time that the Aldersbridge Navigator program has been up and running, because it's a pretty new program,
Yes, it
have
is.
you found the need increasing?
Yes, I definitely, I definitely see that. And I've been dealing with folks from all walks of life, folks, from, engaged with some of the senior centers, some of the high rises, some of the RSCs have been, the resident service coordinators have contacted me with some of the situations and cases that, that they're dealing with. And although they try and help as much as they can, sometimes it's like, you know what, we gotta bring it to the next level. So I've kind of seen as the word is getting out, and part of that has been from the networking groups and things that I've been involved in. I've had some peers that have called or had folks call and say, I got your name from so-and-so, and been able to, assist folks from that standpoint. And it could be, sometimes it's just literally, someone may be calling and just asking some questions in regards to elder care attorneys. You and I have talked about this. I have a strong feeling in regards to even that. I mean, I'm not saying that David Smith down the road isn't a good attorney, but if you're looking to try and engage someone and you're looking to try and, look at your your assets, and maybe you need a durable power of attorney, the medical durable power of attorney. You're looking to go into long-term care. You really need someone who has that long-term care expertise, because they know the ins and outs of the law, and that's the best person. And again, I usually will give people, I'll find out where they're from, and I'll give them, in many instances, 3 or 4. These are different options, and encourage them to have as much information as they possibly can gather together, so when they do go for their consult, they actually are able to get the best information possible.
Now, when you and if there happens to be an attorney out there with that name that was not directed at them personally, that was used as a generic name,
Yes, it was.
just just to protect ourselves,
I don't even know if there's a David Smith out there, but okay, yes,
just in case.
Yeah.
Is there the organizations or the businesses that you might refer to, like the elder law attorneys or an estate planner or a moving company, are they referral partners? Meaning, do you get paid for referring customers to them?
No, there's no payment on any level in regards to any of the referrals that I make. It's solely based on
Geography.
need and exactly the need in the area.
Yep.
And we all know, Rhode Island is very territorial, so you're not going to give information to someone who lives in Providence to them in regards to someplace south or in North Country, because they don't want to hear it.
Yep, exactly. Same thing here with our elder info. Like, we look at the geography of it. So, for all the services that you're able to connect people to, and help people navigate that health and social service system, are there income guidelines that people have to meet to be able to schedule a time to talk with you, or do they have to pay a fee to meet with you? What's the money aspect of what
Sure.
you do?
So it's really an individual thing. So it's based on obviously sliding scale from an income standpoint, and then it's a matter of, is it resource referral, is there a case management situation that it's going to take 10, 12 hours to to work on, and that to do the initial assessment. It's really on an individual basis, and it's really looking at all of the pieces to what that person is in need of.
So it really kind of depends. And I'm going to take a guess that there are a lot of folks who, if they're Medicaid eligible, you're able to connect them with the case management agencies that can also do some of that stuff too for free.
There's a number of, yes, so, which is why I was saying it could be, and it really is income based. So it could be sliding scale, could be, there's going to be people, and there have been people that I'm working with that based on their income, that the Navigator is absorbing that, again, based on the whole concept of being Elders Bridge being nonprofit. So we're working with all different income levels and all different situations. So we want to make sure that people are getting the services that they need. That's the bottom line.
See, and that's why you and I get along, is we've got that same philosophy of just get people the information and resources they need.
Mm-hmm.
So I just want to recap real quick. Where are you located if people wanted to come into your office?
So my office is located actually within Linn Health Center.
Okay.
So it's right off of 30 Alexander Avenue in East Providence. Most situations I found, I do have one person who's come into the office, but most folks are more comfortable with me making an appointment to go see them, which actually works out well, because then I can also see your home environment and kind of honestly get a feel for what's going on. Because as I said, sometimes people call me and say I need ABC, and then when I get out there, and I'm starting to talk to them and seeing their home environment, we talk about, okay, so maybe you could benefit from something. Maybe you could benefit from, you're home alone. Maybe you need to benefit from a life alert, or one of the emergency response systems. And they're like, what is that? So then we talk about that, and there's different options with that. You have the Lifeline, and you have auto alert. There's just depends on what's happening with that person.
Absolutely. And so there's a sliding scale fee
Mm-hmm.
for your services. You'll answer the phone when people call,
Mm-hmm.
and answer the questions on the phone too.
Or if I'm not available to answer the phone, I do have, obviously, the answering machine. You can leave a message, and I will absolutely get back to you.
Okay. And how about email? Can they email you?
Sure, they could do that.
What is your email?
My email is navigator@aldersbridge.org. Oop, there it goes right now on the
Isn't
the
that
box.
magic? See, that's why I have Ben as the Oz in the back.
Yeah, the timing was right.
Yes, yes. And so is your program a for-profit program or a nonprofit program?
It's not for profit. And it's a non-profit program.
So if people out there watching wanted to support the work that you do and getting people connected to services that they need, how can they do that? Do you need volunteers? Do you take donations? What would be helpful?
So, actually, I mean, we certainly would take donations, and the donations could be to Aldersbridge communities,
Mhm.
and highlighted as a Navigator program. And that could go to the 30 Alexander Avenue in East Providence. And gladly accept, any donations, because, as again, knowing that we service all different populations, it's always, it's always helpful to, to have that assistance from folks that will support, the good work that you try and do every day.
Absolutely. Kathy, I'm so glad you were able to come on today. I think the work that you're doing is so important, that people know about. Thank you so much for coming on.
Well, thank you for having me. I enjoyed it. I appreciate it. Thanks so much.
Thank you.
Yeah.
Well, everybody, it is an amazing program, the Linn Navigator program, or the Aldersbridge Navigator program, and it's open to everybody and anybody. So please feel free to reach out to Kathy. It is absolutely amazing. Kathy and I go back and forth on the phones when we've got situations that kind of are like, we really are happy to work together. She's a great resource for the community. And I know that we're coming to the close of Friday, friends, but I wanted to tell you, don't forget Saturday, June 18th, Calling All Veterans Day. It's going to be taking place at 2111 Plainfield Pike in Johnston. It's in a big outside field so that we can be safe in the event there's any kind of COVID issues going on. It is on the grounds of the Plainfield Pike Flea Market. If you're familiar with that, renting out that whole field so that we can have a bunch of resource and information providers for veterans, their families, and the community to get connected with the information and resources that are out there. So if you are a veteran of any era, I want you to come, because if you are an older veteran, we have some aging resources that are available. If you are a younger veteran, you might be caring for someone, your parents or grandparents. There's going to be resources there. It's also going to be really fun. There's going to be military vehicles on site for you to check out. So, some of those World War II vehicles are going to be on site. I always think that's very interesting. We're going to have military memorabilia. We're going to have live music. There'll be a concession stand. If you support veterans, come. If you are a veteran-owned business, please come. I'm looking to create a resource list of veteran-owned businesses that we can help support those businesses and also help those businesses support our veterans in the community who may be in need. So again, that's going to be Saturday, June 18th. Opening ceremonies are at 10 a.m. Closing ceremonies are at 2 p.m. or 1400 military time. 2111 Plainfield Pike. We're going to have guest speakers going on throughout the day so that you can get expert information that you need. And if by some chance you can't make it there, it is going to be live streamed. So I want to make sure I see all of you on June 18th. In the meantime, I will see you next Friday. Be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.